So I want to walk you through 3 stretches that you can do right now for a strained neck. They're relatively simple, they're light, they're easy to do. That being said, there are variations of a strained neck. Some are a lot more severe than others. So if you have any sharp pain or anything like that with any of these, I'd suggest you not do it overall, and you'd rather probably find an expert to figure out what's actually going on. Sometimes we think it's a strained neck, and it actually might be a pinched nerve, irritated disc, irritated facet. So some of these things that are kind of deep down in the spine that you may not have thought of. So I just wanted to kind of put that as a disclaimer. That being said, let's get on to it. So I'm going to put my right hand underneath my right cheek if I have a right-sided strained neck. That's not always the case. Sometimes I've seen it help both ways, but generally speaking, that's what I'm going to encourage you to do. I want you to sit up nice and tall, and then what I want you to do is to bring your chin toward your chest using the opposite arm. Now I like breathing with almost all my exercises, so I'm going to do a nice deep breath. Exhale. Good. Again. Exhale. If I can take myself a little bit further and further, I'll do that each and every time. Now notice, and I'll just do a quick side view here. From the side, as I was doing that, I'm not slumping. Keep the chest up tall with really all of these that I'm going to show you. So I say, shoot for that one. Do that one about 5 to 10 reps, 3-second holds. I'm going to give you 2 other variations that you can try. You might find that one is really all you need. One felt best, so feel free to do that. That's totally fine. The next one, sometimes people strain their neck on the outside or the lateral side, so we're going to go side to side with this one. I still like locking my hand down underneath me. That kind of keeps everything in tension so you don't compensate through your shoulder. Chest up tall, ground my head again with my non-affected side. I'm going to pull straight to the side. Deep breath in. Exhale. Inhale. Exhale. By the 3rd rep, I can really get into it. You'll notice muscles kind of decrease their guarding as you keep doing it. When I've had people do that, I've found that sometimes they don't keep their head pointing forwards. With this stretch, they'll kind of rotate. We're going to show you a rotary stretch in a second, but make sure you're doing this in a way you're keeping your head pointing forwards. Don't allow it to deviate. Don't allow it to rotate or bend backwards. Kind of keep it slightly forwards and then pointed forward, so you're coming to the side. With that particular stretch, keep the head forwards and just go side to side. It's funny, a lot of people aren't quite sure where their head's at in space, and it's hard for them to do that. So you might need a mirror, you might record yourself using a camera, set up with a tripod, and just make sure that you go truly side to side, because we're hitting specific muscles with that strained neck when you're doing so. So just make sure you keep that in mind. The 3rd one I want to walk you through, we are going to actually add some rotation, and we're going to head towards the opposite-sided armpit. So if I strain my neck on the right side, I want to bring my chin towards the opposite-sided armpit. So I'm going to get in this position, use my opposite arm. I'm going to pull my chin towards my opposite armpit. Deep breath in as always. Exhale. Good again. And one more. Slowly come out of that. I would actually repeat each of those 3-second holds, and a good estimate is about 3 to 5 times that you could try that. You might find that putting heat on the neck before kind of helps soften things up. If people have a strained neck, they tend to be kind of guarded, and if you're really guarded, it's hard to get into the stretch. So try a little heat with this before. It certainly won't hurt after. If you're having more pain later on in the day from doing this, you've got to differentiate. Does it still feel just like a strained neck, or does it feel like something different? If you have a nervy, burning pain that comes on later tonight after you do these for whatever reason, you might have something more than a strained neck. That might be just the tip of the iceberg as to what's actually going on. Otherwise, if it truly is just a strained neck with some strained muscles, I tend to find that these do a really nice job of kind of softening things up, softening the blow, getting some blood flow, decreasing muscle tension and muscle pain, and getting you on the right direction. So thanks for stopping by. I hope that helped. My name is Dr. Chet Kuntz. Have a great rest of your day.